Hello and welcome. Today we're diving deep into a common yet often painful condition, bladder stones. We'll explore everything from what causes them to how they're treated, so you can gain a comprehensive understanding of this urinary system ailment. So, what actually leads to the formation of bladder stones? In essence, they develop when minerals in concentrated urine crystallize and harden within the bladder. This often happens when the bladder doesn't empty completely, creating a stagnant pool where these minerals can accumulate. Several factors can contribute to incomplete bladder emptying. These include an enlarged prostate in men, which can obstruct the urethra, nerve damage, often due to conditions like diabetes or spinal cord injuries, which can interfere with bladder muscle control, and, in some cases, kidney stones that pass into the bladder and grow over time. Dietary factors, while less direct, can also play a role if your urine consistently contains high levels of certain minerals like calcium or oxalate. Now, let's look at the pathophysiology, or how bladder stones actually develop. Imagine a grain of sand entering your bladder. This could be a tiny crystal formed from excess minerals or a small kidney stone that has passed down. If the bladder isn't emptying properly, this grain can become the nucleus for a stone. Layer upon layer of mineral deposits then build up around this nucleus, much like an onion, gradually increasing the stone's size. The longer the urine remains stagnant and the higher the concentration of minerals, the faster the stone grows. This process can take weeks, months, or even years, depending on the individual and the underlying causes. Bladder stones affect people worldwide, but certain groups are more susceptible. They are more common in men, particularly older men with enlarged prostates. People with neurological conditions affecting bladder function, like multiple sclerosis or Parkinson's disease, also have a higher risk. Diets high in sodium, oxalates, and purines can contribute, making prevalence higher in areas with specific dietary patterns. Finally, dehydration and insufficient fluid intake play a significant role, as concentrated urine is a key factor in stone formation. The signs and symptoms of bladder stones can vary greatly. Some people experience no symptoms at all, especially if the stones are small. However, when symptoms do occur, they can be quite bothersome. Common symptoms include abdominal pain, often in the lower abdomen, difficulty urinating or a weak urine stream, frequent urination or a persistent urge to urinate, even when the bladder is empty, pain during urination, blood in the urine, also known as hematuria, and urinary tract infections. It's important to note that these symptoms can also be associated with other conditions, so a proper diagnosis is crucial. Diagnosing bladder stones typically involves a combination of methods. A physical exam, including a review of your medical history and symptoms, is the first step. Urine tests, such as a urinalysis and urine culture, can detect blood, infection, or abnormal mineral levels. Imaging tests are essential for confirming the presence and size of the stones. Common imaging techniques include X-rays, which can sometimes visualize stones directly, ultrasound, which is invasive and uses sound waves to create images, and CT scans, which provide detailed cross-sectional images of the bladder and surrounding structures. Cystoscopy, a procedure where a small camera is inserted into the bladder through the urethra, can provide direct visualization of the bladder and stones. Bladder stones are not generally classified into distinct types, like kidney stones based on their composition. The primary differentiator is typically their locus and lichen within the bladder. However, knowing the mineral composition of the stone can be useful to understand why they formed and prevent reoccurrence. Analysis of stones collected after removal can show they are composed of calcium oxalate, struvite, uric acid, or other mineral combinations. The treatment and management of bladder stones depend on the size, number, and composition of the stones, as well as the presence of any underlying conditions. Small stones may pass on their own with increased fluid intake. However, larger stones usually require intervention. Cystolitholepaxy is a common procedure where a cystoscope is inserted into the bladder and the stones are broken up into smaller pieces using lasers, ultrasound, or mechanical devices. These fragments are then flushed out. Open surgery is rarely needed but may be necessary for very large or complex stones. Addressing any underlying conditions, such as an enlarged prostate or nerve damage, is also crucial to prevent recurrence. Medications may be prescribed to manage pain, control bladder spasms, or treat urinary tract infections. Preventing bladder stones involves a multifaceted approach. The most important step is to stay well hydrated by drinking plenty of fluids throughout the day. This helps dilute the urine and reduce the concentration of minerals. Dietary modifications may be recommended based on the composition of any previous stones. This might involve limiting sodium, oxalate, or purine intake. Regular urination and complete bladder emptying are also essential. If you have an underlying condition that affects bladder emptying, such as an enlarged prostate, work with your doctor to manage it effectively. Regular check-ups can help detect and address any potential issues early on. The prognosis for bladder stones is generally good with appropriate treatment. Most stones can be successfully removed or broken up, and symptoms often resolve quickly. However, recurrence is possible, especially if underlying conditions are not addressed. Recent research is focused on developing less invasive techniques for stone removal and better understanding the factors that contribute to stone formation. One promising area of research involves developing medications that can help dissolve bladder stones or prevent their formation. These advances offer hope for more effective and less invasive management of this common condition in the future. Thank you for watching, and we hope you found this information helpful.